Welcome. Hi, I'm Cathy Cole. I'm the Cancer Program Director at Los Robles Health System. I want to talk to you today about doing a clinical breast exam. This is something that your physicians are probably doing in the office, but it's really important for you to get to know your own breast tissue, and I'm going to show you how to do that. It's best if you still have monthly menstrual cycles to choose after the menstrual cycle ends. This is when the breasts are least lumpy. If you no longer have menstrual cycles, pick a day that you can remember, such as the first of the month or the date of your birthday. The sequential use of doing a breast exam on a monthly basis, about the same time each month, is going to give you an idea of any change that may occur. Now, the best way to do a breast exam is with the flat parts of your three middle fingers, and usually it's a dime size, just the top pad of your finger, and you want to start under the collarbone. You know, most people think they have to do a breast exam in a circle of the breast tissue that fits into the cup of a bra. The actual area of a breast you want to follow is more like a dress pattern. It actually goes from the collarbone to the bra line, and from the breastbone all the way to the armpit area. Breast cancer does not necessarily just start within the mound of the breast. So it's important that you start there with the flat parts of your fingers and make 3 dime-sized rotations and use a vertical strip method to go down the whole area of the breast. This is really important to do this lying down when your breast is flatter against the chest wall. And then at the end of the exam, you want to also slide your hand into the armpit to be sure that you don't feel any enlarged lymph nodes. Another part of the breast exam, which is quite important, is to look visually at the skin of the breast. Sometimes a breast cancer will not manifest itself as a lump, but more like a skin change or a pulling of the skin. That's another important aspect that you should be able to know any change that occurs from month to month. There's a couple of arm maneuvers that are really important that you can do while preparing for bed or when you're preparing to shower, but you should look in the mirror and be certain about a few things. Raising both arms up over your head allows the breast to move up on the chest wall, and you can see if the skin pulls in any direction that normally you wouldn't notice on the other side. Then you want to bring both arms onto your hips and you want to push in gently. This flexes the chest muscle underneath the breast, and sometimes a tumor can be more noticeable or a skin change you didn't notice before can be more obvious. And then the last part is leaning forward. When you lean forward, you're watching to see how the breast gently falls forward and that the nipples are falling in the same direction. This helps us to know that both by the palpation and by the observation that the breast exam is normal. Any changes from month to month that you notice should always be taken to your physician for further evaluation.